Vaginal birth after caesarean section refers to the process of delivering a baby vaginally after a previous caesarean section birth. It offers an alternative to repeat C-sections for women who have had a prior surgical birth. VBAC is a complex decision, influenced by a range of factors including maternal health, previous birthing experience, and individual preferences. This video aims to explore the benefits and risks associated with VBAC, providing an in-depth understanding of this option for expectant mothers. Benefits of VBAC. Lower risk of complications. VBAC, when successful, is associated with lower rates of surgical complications compared to repeat C-sections. It eliminates the risks associated with abdominal surgery, such as infection, blood loss, and organ injury. Shorter recovery time. Vaginal birth typically involves a shorter hospital stay and faster postpartum recovery compared to C-sections. Mothers who opt for VBAC can usually resume normal activities more quickly, allowing for greater bonding with their newborn. Reduced risk of future pregnancy complications. VBAC has been linked to a lower likelihood of placenta previa, placenta accreta, and uterine rupture in subsequent pregnancies. It also reduces the chances of requiring multiple C-sections, which may increase the risk of complications in future pregnancies. Lower risk of respiratory issues for the baby. Babies born vaginally have a decreased risk of developing respiratory issues compared to those born via C-section. During a vaginal birth, the compression of the chest aids in clearing fluid from the baby's lungs, reducing the chances of respiratory distress. Enhanced bonding and breastfeeding. The hormonal changes that occur during a natural birth can facilitate bonding between the mother and the baby. Additionally, the absence of surgical interventions may support early initiation of breastfeeding and a smoother breastfeeding experience. Risks of VBAC. Uterine rupture. The most significant risk associated with VBAC is uterine rupture, albeit rare. This occurs when the scar from a previous C-section tears during labor, potentially leading to severe bleeding and harm to both the mother and the baby. However, the risk of uterine rupture is relatively low, with studies suggesting a rate of around 0.5% to 1%. Emergency C-section. In the event of complications during a VBAC attempt, an emergency C-section may be necessary. Situations like fetal distress, prolonged labor, or failure to progress may require swift intervention to ensure the well-being of the mother and the baby. Infection and other complications. Although the risk is generally low, any vaginal delivery carries a small chance of infection. And other complications, such as perineal tears, hemorrhage, and postpartum hemorrhage. These risks are inherent to childbirth and should be considered alongside the benefits of VBAC. Limited availability of healthcare providers and facilities. VBAC may not be an option in certain healthcare settings due to limited resources or institutional policies. The availability of experienced healthcare providers comfortable with managing VBAC may be a deciding factor for expectant mothers. Psychological factors. For some women, attempting a VBAC can cause anxiety and stress due to concerns about the previous C-section experience, fear of uterine rupture, or perceived societal pressure. It is essential to address these psychological factors to support a woman's decision-making process. Conclusion. Vaginal birth after caesarean section offers numerous benefits for women who have had a prior C-section. These include lower risks of surgical complications, faster recovery, reduced likelihood of future pregnancy complications, improved newborn outcomes, and enhanced maternal bonding and breastfeeding experiences. However, VBAC also carries potential risks, such as uterine rupture, the need for emergency C-sections, and other childbirth-related complications. It is crucial for healthcare providers to provide comprehensive counseling, taking into account individual medical histories, preferences, and available resources, to support informed decision-making and optimize outcomes for expectant mothers. Thanks for watching. Please subscribe to the channel.